when women often are diagnosed with breast cancer, it becomes their whole world, and they sometimes focus on that regardless of their long-term risk, and sometimes their follow-up care for their other comorbidities sort of takes, second fiddle and falls sort of by the wayside. And one of the things we looked at were in women over the age of 65 that have comorbidities, what their adherence rates were to their other medications, their non-breast cancer medications. So we looked at women that were adherent to their hypertension medications, diabetes medicines, cholesterol medicines before their diagnosis, and then looked after their treatment was complete whether or not they were still adherent to those medications. What we found is that anywhere from 20% to 30% of women, depending on the medication, stopped taking their medications regularly, probably because they overestimated their risk of breast cancer and underestimate their risk of cardiovascular disease. And what was really concerning is that we found that of women that stopped taking their medications who became non-adherent, their risk of having a cardiovascular event was higher. Because we do so well with breast cancer, and most women with breast cancer survive their breast cancer, it's really important for us to pay attention to their other comorbid disease management, make sure patients are following with their primary care providers, because in many ways they're more at risk of dying from cardiovascular disease than breast cancer.